Hi, everyone. I'm Mike Mercurio. I'm a principal with the law firm Offit Kurman. Today, I have the great pleasure of sitting down with my friend, Brendan Glackin of Glackin Physiotherapy. Brendan, welcome.
Thanks so much for having me, Mike. Glad to be here.
My my pleasure. My pleasure. So, before I get into your background and all that, I just wanted to give the audience a little bit of how I come to know you. So Brendan's been a great help to me. I'm an active person in life, and I play a lot of sports, especially competitive ice hockey and some other things. And as I get older, I find myself running into injuries and pools and just nagging things. And Brendan's been really helpful with his approach, and he's got some approaches on chronic pain and how to keep yourself fit as you get older, helping me. And that's how I got to him. I got to him through a friend of mine, Vic Salvaggi. We did an interview with Vic, and Brendan and Vic worked together. But Brendan's been a great help to me in eliminating a pain and strengthening certain muscular areas. So thank you again for Brendan for joining. And my first question to you is how'd you get involved in physical therapy? What's your background?
Yeah, as a physical therapist, a lot of patients ask me that. So I was a big athlete in high school. I played soccer, I played lacrosse, and I was a big snowboarder. In my sophomore year of high school, I fractured my femur snowboarding. So just
Mm.
straight through the middle of the bone. Yeah, it was pretty intense. Um, and I went through physical therapy. And the problem, after I was done physical therapy, they said you're good to go. I went back to my next soccer season, my junior year, and I was terrible. I couldn't kick the ball from the outside of the 18-yard box and make the goal. That's how weak I was, and I just didn't
Wow.
understand what was going on in my body. So it was a big, big shock to my system. It was a big shock to my athletic ego, and it just caused this obsession with movement that I think just continued throughout my life. But I decided then I'd be a physical therapist and hopefully help people get back to what they like to do a little bit more than unfortunately my PT did.
Wow. Well, that's I don't say a good story. It is a good story. Unfortunate injury, but a great story that got you involved in movement. Because right, we all move. The body needs to move, and so much. Many of us sit so
Definitely.
often that then we try to do those dynamic moves, we can't.
Right.
So tell me a little bit about your education. I know you hold a doctorate in uh, PT as physical therapy, I think, or physiotherapy, and that I know you're always continuing learning.
hmm
Tell us about your educational background and some of the key learnings.
Yeah, so I'm from New Jersey originally, born and raised. I went to Rutgers University, the State University in New Jersey, for my undergraduate, and I went to University of Maryland for my doctorate in physical therapy. And that's what brought me to Maryland, and that's actually what made me stay. I developed so many connections and friendships here that I just never left. Physical therapy requires a good amount of continuing education, just as a requirement for the profession. The first thing that I jumped into right out of school was dry needling. That was something that really
Mhm.
fascinated me in terms of quickly it can get the body to relax. And we even used a little bit of that together, Mike. It started with dry needling and it slowly progressed to fascial elasticity and fascial connective tissue, scar tissue remodeling, things like that. I just continue to learn as much as I can. And, I'm kind of a student of the game, for a matter of speaking. I just keep learning as much as possible.
Yeah. So your business has the word physiotherapy in its name, and I don't know. Maybe
That's
I'm
right.
ignorant, but is physiotherapy different than physical therapy, or is that the formal name? Or tell me a little bit about that.
No, that's not ignorant at all. That's another thing that a lot of people ask me, just because the traditional United States term is physical therapy, but everywhere else it's actually physiotherapy. In Australia and the UK and Europe, they all refer to the profession as physiotherapists. A lot of the research when I was in school, a lot of the research I was reading was coming out of Australia and the UK, and to me, physiotherapy was a term that meant a step forward or kind of cutting edge type of research or rehab. So I wanted my business to model that. So I decided to take the physiotherapy name just to show that we're not like a traditional physical therapy office. We're kind of a step forward, or we're always doing cutting edge things or just staying on top of the latest and greatest.
Well, thank you. I didn't know that. I didn't realize physiotherapy
Mhm.
had a little different connotation than physical therapy. Thank you for educating me. So,
Sure.
as I'm aware, and maybe others are not aware, but you operate your business within the confines of a traditional gym. So you're integrated your
Right.
business into the gym facility environment, and I think it's worked
Mhm.
pretty well. But tell the audience why maybe you chose that deliberately, but why you think that having your clinic or your business inside of a gym works well for you.
Yeah, so it was certainly a deliberate choice, and that's actually how me and Vic met, and that's part of the partnership that we have together. I don't really view rehabilitation and strength and conditioning much different at all. I mean, going back to my example with the fractured femur that I suffered in high school, I think the part of my rehab that was missed was really getting my tissue back up to the capacity that was needed to compete in a competitive environment. Rehabilitation just tends to focus on maybe 0 to 60% of that tissue health, while strength and conditioning tends to focus on that 60 to 100 to really sometimes
Mm.
even push the limits of 100%. So I think they're kind of one and the same. You can kind of intertwine rehab with strength conditioning and vice versa. So I don't really view them as separate. And I think that's what people really need to get back to their activity, whether it's hiking or playing hockey like yourself, or playing competitive sports or being a weekend warrior, whatever it is.
But it's interesting what you just said, because I think people tend to put, and I know they do this with lawyers and other related professionals. They put them into their own little buckets, right?
For
So
sure.
I go to the PT, and then the other day I go to the gym, and maybe another day I go to my regular medical doctor. When in reality, I think what you're saying is these things all work together and they're best coordinated very specifically.
Definitely. And you talk to any personal trainer, they'll tell you how many of their clients come in a given day and say, oh, my shoulder's really bothering me, or I slept funny, right? And you go into a physical therapy office and they'll tell you how many people say, yeah, my knee feels better, but every time I try to do something intense like lift or run, it's not 100%. So those two things are very, very intertwined.
Yeah, and I've seen it firsthand, because I think the benefit or the advantage you have is because you can walk right out of your clinic, walk right over to the given trainer, and you can say, "This is what we're working on. These are the
Definitely.
exercises I think you ought to be focusing on with this client," and
Mhm.
vice versa. It's like instantaneous feedback, instantaneous adaptability, and a fluid movement of the various services. So I've seen it firsthand.
Definitely. And I've even had times where I might be limited in what I can do in a given session. I go out to Vic or some of the other trainers in kinetic systems and say, this is what we need to get to. I didn't have time to load the tissue, or I just didn't have the ability to load the tissue like it needs to be loaded. Come up with anything creative that you like, but this is what kind of needs to be done. And, the trainers are so
Yeah.
knowledgeable, they know exactly what to do.
Yeah, so we started to talk about my next question, but I want to go down a little further because I think it's so important. Is you
Mhm.
you are a discipline, a very important discipline, but you interact within the realm of a whole bunch of other medical or quasi health providers. So how
Mhm.
do you have a philosophy? For example, how do you work with a chiropractor? And we've talked a little bit about personal trainers, but there's probably others that you interact with. What's your philosophy? What's your approach? How do you navigate that?
Well, I think every profession's different. Chiropractor education has really changed to a point where a lot of the evidence-based chiropractors aren't really much different from physical therapists. We do a lot of movement-based things, a lot of joint manipulation, soft tissue work. Um, so there's even a couple, chiropractors in the area that I work with where we're just bouncing ideas off of each other. Hey, what do you think about this? What do you think about that? We refer to each other if we're kind of stumped on an issue, things related to that. Of course, when it gets into different professions like orthopedic surgeons, they're getting more into the complex nuances of surgery and corticosteroid injections. Sometimes when conservative management just isn't cutting it, sometimes you need a little bit of help from that realm of medicine too. So it really
Hmm,
depends on where we're going, but it varies significantly.
very interesting. So I know you've been doing this for a while. Tell me, you must have some therapy success stories where you help some folks. You don't have to give any names, but I'm sure I know because I've seen some of the people you've helped. Tell us a little bit
Mhm.
about some of the stories of people you've helped who had some whatever they had, whether it's a condition or an injury, what have you, how you helped them.
So my favorite patient to treat is somebody that feels that their condition it's not going to change. And with a little bit of education and a little bit of manual treatment and a little bit of exercise or tissue remodeling, they're suddenly having this brand new outlook on life. That's one of the most rewarding things ever as a physical therapist, to really change somebody's life like that. I've
Hmm.
had two patients that I can think of right off the bat. One was somebody who was suffering from chronic headaches. Now, not everybody's chronic headache is related to the musculoskeletal system, but this person's headaches, they were. So she had
Hmm.
significant tension in her neck, in the upper traps, in the levator scapulae, in the SCMs, and it was referring all of this pain to her forehead, chronic migraines. So we did a little bit of dry needling, a little soft tissue work, strengthening of the
Hmm.
neck, reduced headache frequency from every day to once every 2 months. And that was huge. That was huge for her. So she started to get her life back in a way. So that was incredible.
Hmm.
I'll never forget that one. The
Wow.
second was actually was in the gym, was another gentleman that I was working with. He was a cancer survivor. He had neck cancer, and he had huge fibrosis over here on his neck from the radiation. And the tissue, of course, adjusted to the radiation as it typically does and became very fibrotic. And he was very, very limited in his ability to move his neck. And he just thought, well, but that's how it is. That's what the was going to happen. That's what the oncologist said was going to happen. So I just have to live with that. And that's not true. It's just that the tissue needed to adjust to a certain stimulus and needed to, if the tissue was at 10%, it needed to be fed at 10% and then 15% and then 20%, rather than getting this massive stimulus of 50 to 100% of what it couldn't handle. And progressively the tissue loosened and he got his mobility back, and he was incredibly grateful. And I don't know. Those are just great stories, man. They keep the profession interesting for sure.
Well, certainly very inspiring, and I can understand why
Definitely.
they would be considered success stories. It's kind of cool that you could help somebody who's stuck have a
Sure.
different outlook on life. So I
Hmm.
want to kind of transition, since we've kind of talking about this a little bit. You deal
Yeah.
with a lot of people in chronic pain, and I know that's
I
probably,
do.
I don't know what percentage of your patients, but maybe a lot of them are dealing with chronic pain. And a lot of the
Definitely.
approaches that you take, you try to eliminate pain, but you do it without medications, perhaps. So tell us a little bit about your
Mhm.
approach and philosophy there.
Well, this kind of, this is one of the criticisms as far as the ability of the tissue in the body to handle certain stimuli. The way that just the American life is structured, it's a lot of sitting, like you were talking about before. The tissues really don't get the stimulus that they need. And then when people try to move or they try to do things that they really enjoy, they're just not ready for it. And if tissues aren't ready for it, that causes inflammation, causes breakdown, causes pain. And then people are stuck in this state, like before, like I was saying before with the headaches, where they feel like they just can't get out of it and that's their new normal. So very simply, it's just about meeting the tissue where it is, giving it the stimulus that it needs, and then slowly building on that progress to get people to tolerate things as simple as walking or as simple as running or getting even more intense to strength training or playing a sport that they love. It really is just about the percentage of how broken down is this tissue. How do we get that tissue to adjust to a new stimulus? And then how do we get it to where people want to be?
Mm. Wow. So as I'm listening to you, I'm wondering, thinking that there's a lot of a mental component to some of this. That while you're helping them with a physical
Sure.
component,
100.
you're also helping their mindset in a mental component.
That's exactly right. And that's something that I really strive to get people um, to feel. It's important to feel their pain. It's important to recognize that knowing what's going on will kind of ease psychological stress and kind of motivate them to get better. Because I'm really just a teacher. I'm just teaching somebody how to move and I'm giving them the right stimulus, but I can't force anybody to do anything. They have to be willing to do it. That
Mm.
education, that psychological piece comes in big time.
So speaking about education and learning and teaching, I know
Mhm.
you do some teaching, and I know most recently you did some teaching overseas, in particular in India. Why don't tell us a little
Right.
bit about that experience and maybe the approach of Indian practitioners like you Tell us a little bit about that experience.
Oh man, so teaching in general, I teach in the United States as an assistant instructor for this company, myopia seminars. They tend to focus a lot on dry needling, which is what I'm an assistant instructor for. So they go not just into the dry needling, but into the pain sciences, chronic pain, and that's where I get a lot of research and literature from. As far as my most recent Indian or experience to India, I was a lecturer for a lower extremity series. So we focused a lot on the low back, the hips, the ankles, and the knees. And it was an incredible experience. I think I've told you privately, Mike, that going there, I was like a superstar. They had banners on the hospital with our faces on it. I mean, they had billboards in the street. It was incredible. It was really very, very cool. They were so accommodating. It was unlike anything I've ever experienced. And as far as the education level, they were so knowledgeable. All the questions they were asking were, I mean, they were really making you think. They were great questions. Something that was interesting about the culture there is they're so eager to learn that sometimes they'd ask you maybe 4 or 5 questions in a row, and you'd answer a question, and then they'd quickly have another one, and they'd quickly add another one. So you really needed to be on your game pretty much all day. It was great. It was incredible.
That sounds like a wonderful experience, certainly. So the part of the reason why we're speaking via video and not in person is because we've been in the midst of this COVID-19 pandemic,
Yep.
and I'm sure our business has been affected. I'm sure your business has been impacted. Tell us
Definitely.
how this pandemic has impacted your business and perhaps your industry.
For my personal business, there was maybe about 40% of my caseload that was Medicare based, a population 60, 65 and above, which is a high risk population for this COVID-19 pandemic. So to keep them safe, all appointments were canceled, which, unfortunately caused a loss in caseload. When everything was going on and we just weren't sure about how contagious it was and how much it was going to affect those around us, I made the decision to move a majority of my appointments to my home office. So I just had more control over the environment. I was able to clean more thoroughly. I was able to regulate who was coming in and out. I was wearing my N95 mask, which was giving me marks all over my ears and all over my nose, like a lot of people can relate to. And once things started to clear up a little bit, I started to go back to the gym environment and put people safely in a position where they had their protective equipment on. I had my protective equipment on, and we were starting to load tissues like we needed to. I just don't have the equipment that Vic has at Kinetic Systems at my house, unfortunately. But it's slowly building back up from a caseload perspective, not where it was 100%, but it's getting there. But as far as the profession as a whole, there's a lot of us that transition to telehealth. And personally, that wasn't for me, if I'm being honest. I felt like physical therapy loses a little bit on camera. It's not as personal. We can't kind of touch and feel certain muscles that are dysfunctional and give validation to people who have been experiencing pain and allow them to say, yes, that's my pain. I'm so glad that you found it and you're able to help. But at the same time, there have been a lot of physical therapists that have been very, very successful with it. So I think that's where our profession may go in the future. We may find that, it's not as outlandish as we thought it was. It could actually be pretty effective, and we might start seeing that a little bit more.
Yeah, I mean, your profession is a lot of hands-on, so I would think it would be difficult to be doing a video where you can't actually manipulate the joint or massage the muscle or what have you. I imagine that could be difficult, but but good for you to be flexible enough and your industry be flexible enough to be able to adapt, because we don't write the script for this, right? I mean, the script is written for us, so we have to we have to find ways of operating our business within the new paradigm, if you will.
Right. And that's a challenging point for everybody, but we'll see. If it keeps going the way that it's going, it might be a more permanent thing to have physical therapy and telehealth, but we'll see what the future holds.
Yeah, no, I did, no doubt, and with the talk of I guess this rubber band snapback effect, it seems like this type of new norm may be the well, maybe our normal for a bit, telehealth or video and Zoom, and sounds like you've adapted your business pretty well to that
Mhm.
new norm. So I have
Yeah,
a few more questions. I have one or two, but I have one. I'm going to actually. I thought of it. I'm gonna put you on the spot. So hopefully it
please do.
doesn't doesn't take you for a loop, and it shouldn't. So you're a business owner. You're a physical therapist, physiotherapist. You're a business owner, and I'm a business owner. I'm a lawyer, and I talk to lots of business owners. And part of why I like to talk to people in businesses is because I find that, and maybe you would agree that a lot of what we need to know is out there in the world. We just have to discover. In other words, we're not necessarily reinventing the wheel. Maybe some of us are coming up with new things that have never been done before. But for many of the things that we do, especially in business, it's out there to be discovered. So my question to you is,
Mhm.
you're a business owner, you've been operating your business for a bit, um, and you have a degree
Mhm.
of success, you're very successful. What would you tell somebody that is
Mhm.
new to business, even if it's PT business or even just business? What have you learned, like as a business owner? What would you tell somebody and they're new to business? Like, what piece of advice would you give
Oh, that's a great question. I
them?
think you can relate to
I
this
started to
too,
put you on
Mike.
the spot. Yeah.
It's great. And people who are starting their own business, I think this is really important to hear. When I first started my physical therapy business, I thought my business was so different from somebody else's. Let's say like your business, Mike, or like Vic's business, but it's really not. A lot of business principles are actually relatively uniform. It just changes what you're, I don't want to use the word selling in healthcare because people don't tend to like that, but that is true. It's just what you're selling changes, but the principles don't. My recommendation, something that I've really thrived with, is joining a mastermind group with people who are all
Mm,
business owners on various professions. So this mastermind group has accountants, it has contract lawyers, it has um, um, marketing professionals, it has staffing companies. And when we talk to each other, it's so funny to hear some of their problems are my problems and some of my problems are their problems. It doesn't matter. We're all experiencing the
yeah,
same thing, even though the profession's different. So if you jump in a group like
yeah.
that and you are surrounded by like-minded professionals who are owners of a business, even if it's not your own business or it's not in the same subset of business, you can learn a ton and
Yeah.
realize we're not so different.
That's a great, really great observation. And it's interesting you say that because, as you know, I'm a corporate lawyer, and so I often hear about business, and you're right. I think a lot of business is the same. I mean, we all have to deal with real estate, and we have to deal sometimes with employees, and we have to deal with
For
receivables, and
sure.
we have to market our businesses, whether I'm a lawyer or you're a PT or what. So there's a lot of commonalities,
Exactly.
and people just forget that. So
I totally
very
agree.
good advice. So I know you're a busy guy, so I don't want to keep you much longer, but I do have one last final question for you, just to kind of leave it there. Do you have any suggestions for
Sure.
best practices that folks can do in their home or do remotely to improve their body functionality, given that, especially now we're all sitting so much? Is there any best practice or
Yeah.
advice you might give?
One of the beauties of the COVID-19 is how many people have really started putting all of this free material on YouTube and their various
Mm,
websites that get people moving. And PT channels on YouTube and personal trainer channels on YouTube have all of these videos that have these 10 exercises to do every day to keep your body healthy. And those are great. I mean, those are so beneficial to the body just to keep moving, that the resources are there. So if you find yourself sitting for long periods of time and you YouTube something like 5 exercises that help improve standing posture after sitting, I mean, you will get, thousands and thousands of videos to help. So utilize the
mm,
resources of you, jump on YouTube, um, be proactive, and the answers are there for sure.
mm. That's good advice. I mean, we live in the information age. So to our last point, where
Definitely.
most of the stuff we need to know is discoverable. Same with
Absolutely.
maybe physical health. There's a lot out there. So thank you, Brendan, for your time. Really
Of course.
informative, good information. I learned a lot, and I will see you real soon. Thank you for joining me.
Thank you, Mike. Thanks for having me. I had a blast.